So good afternoon, everyone. Thank you for joining us this afternoon for this Healthy People 2030 webinars. My name is Carter Blakey. I'm the Deputy Director in the Office of Disease Prevention and Health Promotion, or ODPHP. ODPHP is located within the U.S. Department of Health and Human Services and manages the Healthy People Initiative. So just before we begin, I'd just like to note that none of the speakers or planners of today's event have any conflicts to reveal. And we're really pleased to announce that with today's webinar, we are now qualified to offer attendees the opportunity to submit for select continuing education hours. Oops, next slide, please. Great. The next slide. So following the webinar, participants will receive an email from cpd@convex.com with instructions on how to obtain continuing education credit or certificate. So now we can move on to the focus of today's event. So next slide, please. So last year we launched the Healthy People 2030 webinar series, which covered a variety of important topics in public health, including cardiovascular health, cancer prevention. We were joined by over 2,000 attendees from across all 4 events that we held last year. And this year we will continue to host quarterly webinars that feature the latest data on select Healthy People 2030 objectives, including the leading health indicators. And each webinar will feature states, communities, or organizations working to achieve the Healthy People 2030 targets through the implementation of evidence-based interventions, programs, or policies. So you can join our Healthy People listserv to learn more about the dates and themes of the upcoming webinars. So next slide, please. So today's webinar is entitled The Importance of Preventive Services and Lessons Learned from the Pandemic. So the COVID-19 pandemic has affected almost every part of our lives, and healthcare is no exception. Now, services like screenings, dental checkups, and vaccinations are key to keeping people of all ages healthy. And the pandemic caused disruptions in the provision of these services. So over the course of this hour, we'll discuss continued importance of preventive services and highlight lessons learned about the uptake of preventive services during the pandemic at the local health department level. So, first, during today's webinar, we'll hear from Rear Admiral Paul Reed. Paul is the Director of the Office of Disease Prevention and Health Promotion, and he'll present on the importance of the 3 Healthy People 2030 objectives that we'll feature today. Then following Rear Admiral Reed's presentation, we'll hear from Dr. Irma Rispi, who is the Director of the National Center for Health Statistics Division of Analysis and Epidemiology. And Dr. Rispi will provide details on current progress toward meeting objective targets for those 3 featured Healthy People 2030 objectives. And she'll also review the differences observed across population groups. Then finally, we'll hear from Matthew Bobo from the National Association of County and City Health Officials, also known as NACCHO. He will share details on activities at the local level that supported preventive services throughout the pandemic. Then following these presentations, we'll have a moderated Q&A with these speakers, as well as with 3 subject matter experts who represent the various Healthy People 2030 topic area work groups that oversee the objectives that will be featured today. So during the webinar, we encourage you to submit your questions into the Q&A feature located in the bottom right of your screen throughout the webinar. And we'll do our best to address as many of your questions as time allows. So with that, it's now my pleasure to transition the webinar over to Rear Admiral Paul Reed to provide that overview of today's theme and featured objective. So Paul, the webinar is all yours.
All right. Thank you, Carter. And thanks to everyone who's joined us. We're glad to be holding this webinar, and we're really happy that you all are with us today. Let's start our discussion with a brief overview of the Healthy People 2030 objectives that we'll focus on during today's webinar. And if I could, I'll get the next slide, please. Today's webinar is going to feature 3 Healthy People 2030 objectives, which are listed on the screen in alphabetical order by Healthy People topic area. The work groups that support each topic area are made up of federal subject matter experts who help review data and resources associated with the relevant objectives throughout the decade. And that first objective listed here, or IID09, increase the proportion of persons who are vaccinated annually against seasonal influenza, is organized under the Immunization and Infectious Disease topic area work group. And this objective is also a leading health indicator, or LHI, throughout this decade. The leading health indicators are a small subset of high priority Healthy People 2030 objectives selected to bring particular attention to and drive action in key areas toward improving health and well-being. Now, the second objective is MICH08 or MISH08, which is to increase the proportion of pregnant women who receive early and adequate prenatal care. And this is organized under the Maternal, Infant, and Child Health topic area work group. And then the third objective for today is STI04, or reduce congenital syphilis, which is organized under the Sexually Transmitted Infections topic area work group. And these 3 objectives are all Healthy People 2030 core objectives, which means they'll be tracked throughout the decade, and progress toward achieving the targets will be updated as data becomes available. Included on the right side of the slide, you'll see additional characteristics of the core objectives. And these objectives, as opposed to research or developmental objectives, are all measurable and are associated with targets to be achieved by the end of the decade. They reflect high priority public health issues and are associated with evidence-based interventions. They all have valid, reliable, nationally representative data, including baseline data from no earlier than 2015. And data will be provided for core objectives for at least 3 time periods throughout the decade. If I could get the next slide. Now, as a backdrop to our discussion today, I'd like to acknowledge a few key principles that our office and Healthy People 2030 espouse routinely. First, that getting routine preventive care can help individuals stay well and catch problems early if they occur, helping people live a longer, healthier life. And that vaccinations, routine primary care, and screening tests are all important components of preventive care. And the objectives we are talking about today reflect several aspects of good preventive care and can all help keep people healthy. Like the best way to reduce your risk from seasonal flu and its potentially serious complications, including severe illness and hospitalization, is to get vaccinated every year. Like early and regular prenatal care can help a woman have a healthy pregnancy and birth. And effective prevention or early detection of congenital syphilis depends on identifying syphilis among pregnant women, and screening all pregnant women for syphilis and providing treatment right away to women with syphilis and their sexual partners during prenatal care can prevent congenital syphilis. And we can't have a conversation today about comprehensive preventive health care without acknowledging that the COVID-19 pandemic has significantly disrupted delivery of such care, as was mentioned a minute ago. And I can honestly say for myself that I had delays in some preventive health care over the past few years as a result of less available care at the height of the pandemic. And I'd imagine that this is true for just about everybody to some degree. However, during COVID and because of such diminished access to preventive health services, a wide variety of strategies were adopted to support the continuity of preventive services. And Nature will share a little later this hour illustrative examples of how local health departments pivoted to provide and encourage uptake of preventive health services in their communities. Also, the COVID pandemic has made the importance of prevention, detection, and treatment of chronic disease all the more important, as we've learned that many chronic conditions such as obesity, hypertension, and diabetes markedly increase the severity of COVID-19 outcomes. And even more problematic, and exacerbating the challenges that the pandemic posed to assessing preventive services, are many pre-existing barriers to such care, such as having reliable healthcare coverage, and challenges to just getting to a medical provider due to unreliable or accessible transportation, just to name a few underlying social determinants for many Americans. As we come out from underneath the COVID-19 pandemic, Healthy People 2030 can provide a foundation on which to frame recovery that might help the country establish a more equitable, resilient baseline than what existed before the pandemic. And as I've said, identifying and remedying the barriers to accessing preventive services can favorably influence an individual's health and well-being. With Healthy People 2030's focus on increasing preventive care for people of all ages, we can leverage the initiative to organize ourselves towards better health outcomes. Now, let's review the importance of each of the three objectives featured for today. If I can get the next slide. So first, we will cover IID-09, as I mentioned, or increase the proportion of persons who are vaccinated annually against seasonal influenza. As we all know well, each year, flu causes millions of cases worldwide and kills many thousands, many more in some years more than others. It is especially dangerous for people who are very young or old or who have conditions such as heart disease or asthma. And over this past year, we've seen a confluence of respiratory illnesses, especially among children, including SARS-CoV-2, the virus that causes COVID-19, influenza, and respiratory syncytial virus, or RSV, and the challenges this places on our healthcare systems. The vaccination can alleviate the strain on hospitals and prevent severe illnesses and deaths. In the 2019-2020 flu season, the last flu season overlapping the onset of the COVID-19 pandemic, flu vaccination prevented an estimated 7.5 million influenza cases, over 3.5 million influenza-associated medical visits, over 100,000 influenza-associated hospitalizations, and potentially 6,300 influenza-associated deaths in that one season alone. And for those individuals with higher risk of developing flu-related complications, vaccinations are an even more important preventative tool. People at higher risk for flu-related complications include individuals 65 and older, children under 5, pregnant people, and individuals with certain chronic medical conditions such as asthma, diabetes, or heart disease. Sending vaccination reminders, making vaccines available in non-traditional places like workplaces, and reducing costs are important strategies for making sure more people get the flu vaccine. And strategies like these can help us move toward the Healthy People 2030 target for this objective. If I can get the next slide. Our second objective featured in today's webinar is MISH-08, the increase the proportion of pregnant women who receive early and adequate prenatal care. And one of the most horrible public health statistics that I struggle with is that our country's maternal mortality rate is the highest of any developed nation in the world and more than double the rate of our peer countries. And most pregnancy-related deaths are considered preventable. Very regrettably, about 700 women die each year in the United States because of pregnancy or delivery complications. And for certain women, the risk is even much higher. Regardless of income or education level, Black women are 3 times as likely to die from pregnancy-related complications. And beyond maternal mortality, severe maternal morbidity impacts far too many families. Each year, thousands of women experience unexpected outcomes of labor and delivery that result in significant short and or long-term consequences to their health, such as heart issues, the need for blood transfusions, eclampsia or seizures, and blood infections. And we've already mentioned the disruptions to preventive services, including prenatal care, that have occurred during the pandemic. And I'll add here that HHS continues efforts, including data monitoring on the impact of COVID-19 on pregnant people and infants. And the translation of this data will help direct public health action and inform guidance for the care of affected pregnant people and their infants. Barriers that keep women from obtaining prenatal care, including geographic and economic barriers, must be better understood and addressed, particularly through an equity lens, so that all women receive early and adequate prenatal care. Next slide, please. And lastly, our third objective featured in today's webinar is STI-04, reduce congenital syphilis. And syphilis is an infection that is primarily sexually transmitted. Untreated syphilis infection in pregnant women can also be transmitted to the fetus, referred to as congenital syphilis, and this can occur at any time during pregnancy or at birth. And screening moms for infection leads to access to treatment and care that can prevent prenatal and perinatal transmission. And prior to conception, before pregnancy occurs, and during prenatal care, are important times for addressing conditions that can have long-term effects on potential mothers, fetuses, and newborns. Improving access to prenatal care and family planning for all women can improve rates of congenital syphilis as well as many other maternal and child health outcomes. I want to thank you for your time, and now I'd like to turn it over to Irma Arispe to give a data update on these three objectives I mentioned. Irma, it's over to you.
Thank you, Paul. Good afternoon. Next slide, please. I'm pleased to be here with you today to share data for the three Healthy People 2030 objectives chosen to frame our discussion. As Rear Admiral Reed mentioned, the measure on seasonal influenza, could I have the next slide, please? Thank you. As Rear Admiral Reed mentioned, the measure on seasonal influenza vaccination is a leading health indicator, or LHI. The other two measures track early and adequate prenatal care and congenital syphilis. These objectives were identified by a subgroup of the Federal Interagency Work Group, which is the steering committee for Healthy People 2030. The objectives I'll present today are a subset of the many Healthy People 2030 objectives that track preventive care and preventable conditions. Next slide. First, I'll cover seasonal influenza vaccination. Next slide. Seasonal influenza vaccination is tracked using the National Health Interview Survey. This objective tracks vaccine uptake within the past flu season among non-institutionalized persons aged 6 months and over. The target was selected to align with 6 national programs and was based on trend analysis covering 13 flu seasons and conducted separately for children and adults. These analyses indicated that a 70% target was reasonable for both groups. Next slide. This slide shows vaccination rates for healthcare personnel, pregnant women, adults with high-risk conditions, and persons with and without disabilities during the 2019 to 2020 and 2020 to 2021 influenza season. The influenza vaccination rate for non-institutionalized persons 6 months and over decreased from 52% during the 2019 to 2020 flu season to 49.8% during the 2020 to 2021 flu season. The differences in influenza vaccination rates for pregnant women, adults with high-risk conditions, and persons with disabilities, those are the center columns, during the 2 flu seasons shown here were not statistically significant. Compared to the 2019 to 2020 flu season, vaccination rates for healthcare personnel and persons without disabilities decreased for the 2020 to 2021 flu season. Next slide. The next 2 slides show influenza vaccination rates for selected demographic groups for the 2020 to 2021 flu season. Throughout this presentation, when discussing race and ethnicity, we'll look at Hispanic ethnicity along with racial groups, which exclude persons of Hispanic origin. During the 2020 to 2021 flu season, influenza vaccination was highest among females, the Asian population, and adults 65 years and over compared to their counterparts. For the groups displayed on the slide, the largest disparities were by age. The influenza vaccination rate for adults 65 years and over was 82 and 72% higher than that for adults aged 18 to 64 years and children 5 to 17 years, respectively. Next slide. This slide shows seasonal influenza vaccination by income, health insurance, and veteran status. During the 2020 to 2021 flu season, influenza vaccination rates were highest among persons with family incomes at 400% or more of the poverty threshold, those with health insurance, and veterans, all compared to their counterparts. The difference in influenza vaccination rates between persons with public health insurance and those with private health insurance was not statistically significant. The influenza vaccination rates for persons aged 6 months and over with private health insurance and those with public health insurance were both 2.5 times higher than the rate for the uninsured. This represents the largest disparity for all the population groups discussed for this objective. Although not shown, overall, the influenza vaccination rate for insured persons was also 2.5 times higher than that for uninsured persons. Next slide. Now I'd like to discuss early and adequate prenatal care. Next slide. An objective that focuses on early and adequate prenatal care was introduced in Healthy People 2010. The objective is tracked with data from NCHS's National Vital Statistics System natality files. It uses the Adequacy of Prenatal Care Utilization Index, or the APNCU. And with this index, adequacy of care is determined based on when care began and the number of recommended visits a pregnant person should have, adjusted for gestational age. Next slide. This slide shows trends in early and adequate prenatal care for pregnant persons from 2016 through 2021. Although tracking data have been available since 1968, implementation of the 2003 standard birth certificates resulted in a discontinuity in reporting, and also with the data from 2016 and more recent years no longer being comparable with data prior to that time. As you can see, there was a relatively small but statistically significant difference in early and adequate utilization rates between the 2018 Healthy People 2030 baseline, which is indicated by the asterisk, and the most recent tracking data reported in 2021. During this period, there was a noticeable dip in the percent of pregnant persons who received early and adequate prenatal care, from 76.7% in 2019 to 74.7% in 2020. This was followed by an increase to 75.6% in 2021, which falls just short of the baseline rate. Next slide, please. This next slide shows early and adequate prenatal care by the mother's race and ethnicity, country of birth, and educational attainment in 2021. The early and adequate prenatal care rates were highest among white mothers, mothers who were born in the United States, and mothers with at least a 4-year college degree compared to their counterparts. The largest disparities observed across population groups were by race and also by age of the mother, which is not shown here. Next slide. This map displays early and adequate prenatal care in 2021 by state of residence. Early and adequate prenatal care rates varied by region, with the highest and most desirable rates shown in green and light blue in the Northeast, Midwest, and mountain regions of the United States. States in green met the national target. The lowest and least favorable rates, shown in the darkest blue, were observed in the Southeast, Pacific, and Southwestern regions of the United States. Next slide. I'll now discuss congenital syphilis. Next slide. Congenital syphilis is a disease that occurs when the mother with syphilis passes the infection on to her baby during pregnancy. Rates of congenital syphilis are reported annually using data from the National Notifiable Diseases Surveillance System. This objective tracks reported cases of congenital syphilis by year of birth. An objective on congenital syphilis has been included in the Healthy People Initiative since Healthy People 2000. Next slide. This slide shows trends in congenital syphilis rates from 1941, when data collection began, through 2020 by birth year. Congenital syphilis was made a nationally notifiable condition in 1944. The COVID-19 pandemic has made data collection for congenital syphilis more challenging due to reduced screening, limited resources, and social distancing. Focusing on Healthy People 2030 tracking period, the rate of congenital syphilis increased 18.2% between 2019 and the year 2020. Next slide. This slide shows rates of congenital syphilis by race and ethnicity of the mother in 2020. The rates of congenital syphilis for Native Hawaiian and American Indian mothers were more than 35 and 36 times higher than the rate for Asian mothers. Next slide. Oh, I'm sorry. The rates of congenital syphilis for Black, Hispanic, and white mothers were 135, 72, and 28% per 100,000 births, respectively. Next slide. So I'll end by sharing some key takeaways. Next slide. Between 2019 and 2020 and the 2020 to 2021 flu seasons, influenza vaccination rates decreased for the total population, for healthcare personnel, and for persons without disabilities. When we looked at early and adequate prenatal care, we saw that rates declined between the 2018 baseline and 2021. When compared to their counterparts, we found that mothers with less education, as well as those who are Native Hawaiian, American Indian, and Black, were less likely to receive early and adequate prenatal care in 2021. Also, 9 states had met the national target. Overall, congenital syphilis rates increased between 2019 and 2020. For mothers, disparities exist by race and ethnicity. Next slide. Finally, I'd like to thank and acknowledge the Immunization and Infectious Diseases, Maternal, Infant, and Child Health, and Sexually Transmitted Infections work groups, whose objectives were highlighted here today, as well as the NCHS and ODPHP staff for their contributions. Now I'll turn it over to Matthew, our next speaker. Thank you.
Thank you, Irma. I appreciate that. Hello, everyone. I'm Matt Bobo, and I will be talking with you today about working with local health departments and lessons learned about preventative services uptake during the COVID-19 pandemic. Next slide, please. What is NACHO? The National Association of County and City Health Officials was founded in 1965, and NACHO comprises of nearly 3,000 local health departments. NACHO's structure is very much like that of a local health department, with having individual programs representing various public health services such as immunizations, maternal, child, adolescent health, preparedness, HIV, etc. Next slide, please. This is a representation of the public health infrastructure, and while we really explore ways to identify evidence-based practices, local health departments are in a unique position to really understand the nuances that are specific to the communities they serve. Local health departments work with a variety of partners in their communities, including healthcare partners, government agencies, community-based organizations, in a variety of different ways, such as information sharing, regularly scheduling meetings, establishing written agreements, and sharing personnel resources. Next slide, please. This is a snippet from a survey that we conducted in 2017, and we do this survey every 5 years. So one survey just closed in the field, and it's really just to understand what local health departments look like. Each local health department is different and unique, as if you've gone from one state health department to another, you'll often notice that they're very different in terms of the way that they work. Next slide, please. This is just showing you a representation of some of the top activities that local health departments do, and really a lot of them are working in the space of immunizations and really building confidence in this space and trying to bring back trust to our communities. Next slide, please. Now I'm going to talk briefly about influenza and what NACHO is doing to help with getting flu doses up. Next slide, please. This is a snapshot of a portfolio of some of the projects. We are working very much in COVID space, but also very much in the influenza space. And so some of the projects that we have, really they operate as we do something called RFAs. It's a request for an application. And we write up requirements based on money that we received from the CDC, and then we get those funds out to local health departments. Along with that, we have work groups that work with specifically flu and influenza, and then we create communities of practice. One community of practice where we worked very hard is we partnered with the University of Maryland and it was the Shots in the Shops campaign. So this was very much trying to meet people where they were and really bringing COVID and flu vaccine to Black barbershops and just make it convenient and easy for them to get vaccinated, meeting where people are at. Next slide, please. Another thing that we've done and another impact of working with local health departments is really trying to understand those areas or populations of focus through data. In addition to data from the Immunization Information System, the IIS, NACCHO has been able to help support local health departments in enhancing data analysis through a project with CDC, which is shown here. Local health departments can use the data that they already have, but also supplement additional resources as the one shown on the screen. This shows historic flu under vaccination to help prioritize where and how to conduct their outreach strategies. So really laying and mapping out that data to understand where are those vaccine deserts where people aren't getting vaccinated. Along those lines, next slide, please. Many of the health departments we work with have been utilizing a rapid community assessment framework to help quickly gather insight from communities to inform their vaccination strategies. These assessments can be tailored to the local context and is intended to be completed in about a month to allow for quick adaptation that is responsive to local needs. So you'll see some logos, and this is really about trying to get local health departments to really partner with those individuals in the community that know their community. A good example would be like a local university and really working through the data. Next slide, please. Now I'll shift gears and talk about maternal, child, and adolescent health in the prenatal care area. Next slide, please. These snippets just really show our maternal, child, and adolescent health portfolio, our MCAH portfolio. And really in this area, we're working on COVID-19 mitigation strategies. We do a lot of work in the chest breastfeeding program. And really when we're doing education about chest breastfeeding before birth, we're trying to drive home those pregnant individuals to prenatal care programs. So really trying to create those connections and inroads into the community. Another project that we're working on is building resilience through maternal child health and emergency preparedness collaboration. So really making sure that prenatal and maternal health are included in preparedness exercises and workshops to make sure that we aren't forgetting those vulnerable individuals. And then bridging maternal child health, infectious disease, preparedness, and birth defects within cities and counties. Next slide, please. And then as I was speaking, a lot of the work that we do here at NACCHO is a lot of nutrition work and really looking at that first 1,000 days. So really to the start of the pregnancy all the way through 2 years of age, and really trying to make those inroads before someone is pregnant and making sure that those services are available. Next slide, please. Now kind of moving to congenital syphilis. Next slide, please. In terms of what we've done over the last year is NACCHO has collected information on congenital syphilis prevention and control interventions and activities across the United States and gathered those interventions across a spectrum of persons with childbearing capacity and congenital syphilis. as well as information on syphilis screening and testing of persons with childbearing capacity. And then a compendium of the collected responses has been developed to increase that peer-to-peer collaboration. So really creating these community of practices that create best practices that we can then share across the communities of local health departments. Next slide, please. And so as I was talking, really working to build community of practices. Last year, we held a community of practice with about 100 participants. They met monthly. And then this year, we're going to do bi-monthly meetings, and we've had more than 120 participants on a kickoff call. And so we're doing a request for applications starting in 2020, and the goal is to fund 8 sites in total that are working on a final report that will then go to CDC to review. Next slide. And then finally, we are continuing our requests for applications. Most recently, NACCHO has announced 2 new funding opportunities to decrease congenital syphilis. Both opportunities are focused on engaging community members to develop or tailor a plan to decrease syphilis burden in the local community. And so here you will see a link to an RFA, request for applications. We're planning on funding 8 local health departments with $75,000 to $150,000 each. And then also working to fund American Indian and Alaska Native populations, those at more risk of congenital syphilis, and funding 3 organizations at $75,000 to $150,000. So I want to thank you so much for your time, and I will toss it over to Carter for Q&A.
Great. Thank you, Matthew, and a huge thank you to all of our presenters today. We really did learn a lot from you. At this time, we're going to start our Q&A session, and we'll be joined by our work group, topic area work group coordinators from, in this case, CDC. So I'd just like to introduce them to you since I didn't on that earlier slide. So we have Carla Black, who's an epidemiologist from CDC joining us, as well as Romeo Galang, who's a medical officer at CDC, and then Robert McDonald, who's also a medical officer at CDC. So thank you all for joining us for the Q&A. And I think the other presenters can turn their camera back on. I think that's you, Matthew. There you go. Great. So anyway, I'd like to start by throwing a question out to all of you, including our work group representatives. So is there any information you would like to share with all of our listeners to help them inform identification or elimination of disparities across these objectives? Irma had given us some great data that demonstrated some of the differences across different population groups. So, but I'm going to start out because Paul had to leave, and I just would like to point out something that I think he probably would have, that while Healthy People 2030 does provide a pretty comprehensive collection of national objectives, we do provide some resources and tools to help users drive action toward achieving our various targets. So if you were to visit our website, healthypeople.gov, you'd find what we call its tools for action. You'll have evidence-based resources that are associated with different objectives. And thanks for our strong partnership with the National Center for Health Statistics and Irma's team, we do have a lot of data on the website, including some data display tools that can help you easily see the data, understand what the data are telling us in terms of national accomplishments, as well as data across different population groups. So with that, now I will give our panelists and our others an opportunity to provide additional information or ideas that you might have to help our listeners identify, approach different ways to eliminate disparities in their communities. So Romeo, I see you've come off mute.
Sure thing. I'll go ahead and jump in first and let the thoughts percolate. I think it's, first off, I want to give a nod to all of our speakers today. Thank you so much for the wonderful presentations. I'm particularly excited that Nacho was able to join this webinar as well, because my point is about the involvement of community voices and community-led initiatives and informed initiatives to help reduce those disparities. Very often we aren't able to see drivers specifically within certain types of data. However, the communities that are affected may have some unique answers for us with regards to the phenomenon of why we're starting to see these effects, and maybe even creative ideas for how to best address these within those locally informed areas, and also what might work best in terms of reaching those specific communities. So I think that's probably one tip or trick, which is also being implemented in several quality improvement initiatives here at CDC as well within reproductive health. Over.
Great, thank you.
Yeah. Hi, this is Carla Black. I can talk a little bit about the flu vaccination coverage estimates. I think, sort of similar to what Romeo said, and Matthew talked about this a little bit in his presentation about, how we're addressing these disparities. A lot of it is by taking vaccination into the community where people are and using trusted messengers. We saw with COVID vaccination that some of the racial ethnic disparities we saw at the beginning kind of went away over time. By making vaccine more accessible and, using these, partnering with more local programs. And we also see a connection. I mean, we see persistent disparities, particularly by race, ethnicity, and vaccination coverage. We also see those disparities in actual hospitalizations and other outcomes from influenza. And that was outlined in a MMWR vital signs that came out in October, even when anyone is interested in that. And that vital signs also kind of outlines some of the things that we're doing to address these disparities, and a lot of like the Partnership for Vaccine Equity program that Matthew talked about.
Great, thank you.
And I will just echo some of what's been said as well, just the importance of looking at the local epidemiology when it comes to congenital syphilis, and really looking and seeing who is most impacted in the community. And then, as was said, really working with the right community partners to make sure that there's awareness among people in the community about syphilis and congenital syphilis, but also among providers serving those communities that are most impacted to make sure that people are looking for syphilis and screening for syphilis and congenital syphilis.
Great, thank you, Robert. And Irma, you're off mute.
Yes, I just want to bring it back to where Carter started us by encouraging people to look at the Healthy People website, because there's a lot of information that we didn't present today that I think would be very helpful in both looking at the data related to the disparities and looking at tools that you can use within your own programs to measure and look at changes in disparities. Elimination of health disparities has been a part of the Healthy People Initiative since Healthy People 2000, and each decade we've improved the information that we provide and the tools, and for Healthy People 2030, for all the population-based objectives, we have what we call the population data template, which allows you to look at the data using about 13 different groups, so race, ethnicity, and age, and some of the groups that you've seen presented here for all of the objectives in Healthy People. And so you can explore the data further there. Also, we had in November of 2022 a product that NCHS did to teach people to look at how disparities decrease over time or increase over time. So you can look not just at the present, but look at the trend and see if the trend is widening or getting smaller. And we're currently working on what we call a disparities tool. We had that in Healthy People 2020. And if you just stay tuned, we'll be launching that again later this year. So thanks.
Great. So Matthew, do you want to throw in a few words before I move on?
I would just encourage individuals to, as Romeo said, looking at the local data and seeing what data you can use, and partnering with universities and other groups, I think is a great strategy.
Right. And then we had a question that came in that's somewhat related to this. It's the immunization disparities by age was very large. Any advice for closing that gap?
I think this is Carla. I think that might be directed at me. I mean, we see highest coverage among those over 65. That's actually the only age group that meets our 70% target. I think this is just a function of more healthcare provider offers and recommendations in that group, and because they seek healthcare more often. And so I think it's really getting providers to recommend vaccine to all patients, and again, making vaccine more accessible at pharmacies, which they are now, but places where younger people seek healthcare.
Right. Thank you. And kind of related to that is a question that came in also about whether or not Healthy People plans to add a new objective to the collection that will address annual COVID vaccination. And that's something, Healthy People is dynamic. We change across the decade to address public health issues. And that could be a possibility, but it would depend on the data available and other factors as well. So it's not out of the realm of possibility, but we would not want to predict what would be added to Healthy People or not. So thank you for asking that question, though. So then, Matt, I have a question specifically for you. During the pandemic, did you hear from any local health departments about collaborations that they were undertaken to help ensure that important services were delivered to populations? I think that's a theme of different discussions we've had elsewhere about how valuable the partnerships and collaborations were that were built during the pandemic simply to ensure that services were continued and delivered throughout the pandemic. A lot of innovation occurred. So Matt, you probably have some real-time examples to share.
Yeah, so I think a lot of the key to what we've learned from COVID-19 is the importance that partnerships make in terms of getting the work done. So in terms of having, for example, going back to the University of Maryland example and having their culture, health, equity component of their university really reach out to Black communities and do the shots in the shops and to barber shops. And really that's meeting people where they're at and bringing the vaccine to them and making it easy. My fear, though, as we kind of move out of the pandemic is as things kind of shoot back to how they were normally, that these partnerships will be lost. And that's something that I don't want to happen. So really trying to understand, okay, this is my community, what works best in my community. So for example, in the Southeast, I'm from Alabama, it might be nice to get a football coach on my champion group in terms of being a champion for immunizations. Or if you're in another community, maybe it's the local church that has the big voice that everyone's listening to. So really just trying to find those champions, those partners, and being open and working together.
Great, thank you for that. And Romeo, we have a question that's come in for you. So has any effort been put into addressing a perception of quality as it impacts early entry into prenatal care?
I think that this was brought up actually quite well earlier with the presentations. Certainly in terms of barriers that keep women from obtaining prenatal care, it's important that we investigate these and better understand them, make sure that is also similarly community informed. There may be geographic variation, reasons may be economic. These really need to be investigated to make sure that everybody receives early and adequate prenatal care. From a quality perspective, I think that there are some things that are being done here within our agency regarding care, to improve care, and to make sure that it is respectful, that it is culturally sensitive, and that it is patient-centered. Part of this campaign includes things like the Hear Her campaign, which fosters better communication between clinical providers as well as pregnant people to make sure that they are hearing when there are urgent maternal warning signs and to make sure that those types of things are adequately addressed. We know that the quality of care that is received can play into how well somebody may come back for subsequent visits, how well they may adopt recommendations made by their clinical care providers, and ultimately affect pregnancy outcomes.
Great, thank you so much. And Matt, we have another question for you. Looking at the services provided locally during the pandemic, were there broad lessons learned related to continuity of services? For example, and you mentioned this, were partnerships and local data a key?
Absolutely. So I feel like what we really learned from the pandemic is where to find local data, but also where we're missing local data. So how can we work with our healthcare systems to make sure we're getting all the data we need? What happened during the pandemic, and I think I'm leaning a little bit towards COVID-19 vaccine, but the federal government required that every state report their data out to the CDC. So it gave CDC a nice perspective and look at our COVID-19 data. But then at some parts, we're missing kind of that local perspective. So marrying the two. And so that was very helpful in terms of partnerships. Also working with schools to understand what's going on with our school systems and understanding that data. So ideally, it's just kind of cobbling all the data together so that our local healthcare providers can understand what's going on the ground level.
Great, thank you. And actually, just throwing it back to others at CDC, partnership has been a thing we've talked about. Have Carla or Robert, did you, during the pandemic, experience any growth in your partnerships or collaborations that helped you get your work done?
Yes, I mean, again, I think all the things that Matthew has already talked about, we, definitely had more partnerships with local organizations and, organizations providing vaccine at alternative sites like churches, barbershops, etc. That, and hopefully these will continue beyond the pandemic.
Right. Yeah, I think we all learned a lot and learned to value our partnerships. So, I mentioned some resources that we have available for Healthy People 2030 on our website, and Irma did as well. But for the others of you, are there other resources that you would like to point out and recommend to our attendees today?
I would just mention, if you're interested to kind of know what's going on the local level, you can go to nacho.org. You can find blog posts and listings of what's going on in various communities. We try to support best practices and write-ups of what's going on with local communities. So please check it out if you're interested.
Great, thank you. Very good. So I think that is we're just about out of time. But the slides that you see scrolling in front of you, just point out some resources that are available to people if you find time to view them. And if you keep on going down through those slides, there you go. So one thing that we've initiated this decade is what we call the Healthy People 2030 Champion Program. And that's a group of organizations, whether they're governmental, non-governmental, private, academic, et cetera, that are committed to achieving the National Healthy People target. So we encourage you to go to healthypeople.gov to learn more. And if you're interested, apply to be a Healthy People Champion. So with that, I think we've come to just about the end of our time. So I'd like to thank everyone for joining. And please be sure to be on a lookout for an email from the CPD at confex.com with instructions on how to obtain your continuing education credit if you're interested. So thank you all.